Hey, I'm Dr. Jonah Ampty, LoveThatFace.com. I know you get sick of hearing this, but I'm a cosmetic facial surgeon in Richmond, Virginia. I only do cosmetic surgery from here to here. I don't do boobs, bellies, or butts, and I'm a teacher, I'm an author, and I'm a surgeon. These YouTube videos have been great for me and great for my patients. I have probably over 500 videos and almost 24 million views, and I talk to YouTubers from all over the world. It's an incredible format. Today we're going to talk a little bit about what not to expect from your facelift, okay? And that may be like, well, why do you need to talk about that? Because it's very important. You know, I do over 100 facelifts a year, deep plane face and neck lift. That's kind of my passion and my most popular procedure. And we talk about this, my awesome staff, we talk to patients all day long from all over the country, and we know exactly what a facelift is going to do and exactly what to expect. However, for most patients, they may do this once in their life, and they may not know anything about it, or they may, you know, with social media have really unrealistic expectations. And so the best patients are the ones that have the most understanding of the procedure that they're going to do. And the more the patient understands and the closer their understanding and expectations are to the surgeons, the better it will be. If the patient has expectations up here and their result's going to be here, that's going to be a problem. So one of the things that you have to do is talk to your doctor before the procedure. And so you have a realistic expectation of what to expect. Now, I have over 10,000 pictures on my website, and I think somebody can look at my pictures for deep plane facelift, for eyelid surgery, for chin implants, for anything that we do. And I have so many pictures that they can look at those and have a pretty good idea of what to expect, and they will actually find themselves in the picture. Not themselves, but what I mean is they'll find somebody with a similar aging process. So, you know, what to expect. Some people have very unrealistic expectations. They think if they have a facelift that they're going to look 25 years younger and that the opposite sex is going to chase them around or they're going to get promotions at work. And, you know, you have to, again, get everybody on the same page. If you don't do that before surgery, then it can be very uncomfortable after surgery when a patient comes in and says, well, you know, you did my facelift, but I still have this or still have that, and I thought I was going to get this and thought I was going to get that. Get all that straight up front, okay? And there are so many things that are pretty simple to explain during facelift, but still sometimes patients don't get it. So what I'm going to tell you right now is really important. A facelift is a procedure that's effective from here to here, okay? The second thing that's really important is it doesn't do anything in this area, okay? So it doesn't help your brow, your eyelids, your nose, your lips, the corner of the mouth, the nasolabial folds. The third thing is the closer you get to this area, the less the facelift is going to do. And when you see somebody out there that looks like this, that's because the surgeon tried to make things look better in that area that you have to be very conservative, okay? So when you do a facelift, a deep plane face and neck lift, will it improve your smile lines? Yeah, it'll improve it a little bit. Will it help the corners of your mouth? A little bit. What's it not going to do? Well, it's not going to make these go away. It's not going to make pooches that are right by your corner of your mouth go away. It's not going to make wrinkles that are in the corner of the mouth go away. Another thing that we see once in a while, patients, you do a great facelift, it looks great, I'm happy, my staff's happy, and the patient says, well, I still have these little ringlets on my neck. Okay, these are something that are etched in the dermis, and if you look, even infants and adolescents have them. So you can pull as tight as you want, but those things, they may be improved, but they're not going to go away, all right? So that's really important. You have to understand what you're going to get out of the surgery and what you're not going to get. So another situation is a patient may come in and do a facelift, face and neck lift, and you have a great result, and they come in and they say, well, my brow's the same, or my eyelids are the same, or and we didn't even do any procedures for that, okay? And the patient says, well, I have a friend, and they had a facelift, and they had a full facelift, and all those areas look better on them. So that's when it's important to explain to the patient before surgery. First of all, a full facelift is kind of an antiquated term. That was kind of in the old days when they used to do that big old brow lift and peel everything back. So we rarely just do a facelift, all right? I do a deep plane face and neck lift. It's very common that I'm doing eyelid surgery at the same time, or maybe brow lift, or maybe facial implants or laser. So the friend that said she had a facelift, she may have had a facelift plus upper lids, plus lower lids, plus brow lift, plus cheek implants, and she considers that a facelift, okay? So again, the nomenclature of, what is a facelift, and then what are the other procedures that you can add on to a facelift that make that difference, very important to understand. So I'm going to show you some before and after pictures of some of my deep plane facelift surgery patients. And it's so important, once again, to summarize, to understand what the lift is going to do and what it's not going to do. Generally, I like to have my patients have a mirror, lay down on their bed, put their chin up and look in the mirror, and that's going to give you a good idea of what to expect from here to here. And just remember, you're not going to get much in here, okay? And the more procedures that you do, the more global changes that you have, okay? And get all that figured out up front, because again, it's a very uncomfortable conversation after your lift. So stay tuned. I'm going to show you some pictures. Thanks so much for your time. That's the greatest gift of all. I'm Dr. Joe, and I am to LoveThatFace.com. So we're going to look at pictures. These patients are right out of surgery. This patient's about a week out. You can see the real improvement in the area under the chin and the neck. It's the deep plane neck lift that gives you that improvement. This patient's 3 weeks out. And again, you can still see her suture lines, but you can see the making that square jaw into a heart-shaped, more youthful jawline. And these looking down pictures really tell the story with the profile. This patient's 24 hours out of deep plane face and neck lift and laser to the chin. And again, on all of these patients, this patient's, I think, 1 week out, you can see the incredible difference. Here's another patient 24 hours after surgery. And again, it is doing this deep plane work, the deep plane facelift and the deep neck lift, that gives this great profile enhancement. It makes these happy patients. So she's still got some bruising. She's about 2 weeks out, but you can see her jowl improvement, that square face of being older, making a round, more rounded, tapered face. Here's another patient, again, improving that profile. And you get so much more improvement when you do this deep neck work. And the deep plane facelift is important, but it's the treatment of the neck that makes really a big difference, because we're reducing muscle and fat and sometimes gland tissue, and that's why you're able to get this really nice, almost right angle in under chin area. So you can see what this does. And when you look at all these pictures, you see jowl improvement and you see profile improvement. You may have seen this patient before. Sometimes I'll take pictures early on in the video, and then I'll see the patient several months later and have more mature pictures. And that's just a great case and a happy patient and a really proud surgeon to be able to do that. Again, with the deep plane facelift and the deep plane neck lift. This patient also may have been in a previous video, I'm not sure. This is a patient I did recently, saw her the other day. She's 3 months out of deep plane facelift and deep neck lift. Look at the square face going to a tapered, youthful face. Look at her neck and her jowls. And again, when you look at this profile enhancement, it just looks so natural, and it doesn't look fake or done. And you have a very happy patient and a very happy surgeon. So I just love doing deep plane face and neck lift. And really, I love doing all cosmetic facial surgery, whether it's eyelids, facial implants, all the other stuff that we do. I'm really lucky because I have fun going to work and I love what I do. If you have an interest in any cosmetic facial surgery, you can go to our website, lovethatface.com, and there's a section Ask Dr. Joe, and you can submit pictures, or you can contact us directly at email info@lovethatface.com. I'm Dr. Joe Nyamtu. Have a great day.